Hi there. My name is Russ Intro. I recently had ACDF surgery. I had really gone back and forth about making a video like this. I was really, when I was deciding on getting it, I was amazed at how many people posted their experience, and it was immensely helpful. And the interesting thing was there were a few that I really found extremely helpful, and I saw those several months back, and just leading up to my surgery months ago or so. I had mine done, by the way, December 14th 2018, and I couldn't find them. So maybe if I dig deeper, I will find them, and I plan to put them in the comments section. But again, I felt a little odd about doing it, but hey, under the category of paying it forward, like I said, I was really blessed by all those people who took the time to put their experience, and if my experience can help you, that'll please me. So, of course, I'm not a doctor, I'm a patient, and everyone's experience is different, of course. Kind of goes without saying. I wrote some notes down, so I'll be referring to my laptop. I guess, and I should go back and say one of the ones that really, and I really wanted to find his was this guy who was, I think he was like either a Big 10, Big 12 football player. He was a linebacker guy. Guy looked tough as nails, a little younger than me, and just to hear him talk about his, this big tough guy, his anxiety, his fears, because let's face it, it's pretty major surgery. So, and he was so thorough, and again, his was really amongst those that were really the more helpful, and there are many others. And like I said, I'm going to try to post all the ones I can find. There's so many out there, and it's just interesting to hear the range of experiences that people have. I'm 12 days out from my surgery now. I think it's 12. I think I'm going to split this up into different parts, right? So just to wrap up this first part, I think to kind of hit the highlights of what I've learned through this process is, number one, this is kind of like duh, but you have to be an advocate for yourself and for your own health. I hope I've learned my lesson, but there have been times in the past when I look back and I was like, what was I doing? I started having problems with my neck about 11 years ago, and I won't get into who our carrier was back then, but this doctor just said, you have stenosis, deal with it. It started to come back, the nerve pain that I have through the years, and later on, I became a better advocate for myself, and so like I said, hopefully I've learned that lesson, and most important for you, get a second opinion. I think everybody says that. I did do that. In my opinion, good doctors are good communicators. I suppose there's probably tremendous doctors out there who aren't good communicators, but if they're a great doctor but you don't know what's going on, what good is that? I mean, it's about you, and if you're not sure what's happening with your body, you probably need to go to a different doctor. The various doctors I saw were all referred to me with really great recommendations. I guess in a sense, what I'm saying is, by the time I got to that doctor, I already had a pretty good comfort level that they were a good doctor. They had high ratings. And then to me, it was just kind of, how did they communicate with me? How did they answer my questions? Was I satisfied with their answers? And so anyway, to me, that's a lesson I learned. Write down the questions, your thoughts, ideas, whatever it may be, before you get in front of your doctor. Again, I guess this probably comes under the duh category, but I was so happy I did it after my surgery, because my surgeon had said, he would call me like the next day, or I think it was 2 days later, and I know if I had not written down all the things that I thought about in those 36 hours, I would have forgotten something. I know I would have. But that goes, you know, doctors are important people. They have a lot of patients to see. They have limited time. And I think we've all done it. Gone to a doctor, left the appointment and said, oh man, I forgot to ask that. So I think that's just great advice. And again, hopefully I'm learning and getting smarter as I get older. If you're having what you think is nerve pain, there are many, many ways that people get relief. Again, I'm probably stating the obvious, but I think ACDF, I think most people would agree, is probably the most extreme way to resolve it. But there are a lot of people who get relief. I went to a doctor that did cortisone shots in the spinal column, and a lot of people apparently really get relief from that. Didn't work for me. I tried many other things, but what was great about the very first doctor I saw, he kept sending me to different doctors. You know, hey, let's get your shoulder checked. Is it your shoulder? And by the time it was down to making a decision, I felt like I had checked all the boxes. Last one is to watch or not to watch. So I wouldn't consider myself a squeamish type person. I actually watched a video of an ACDF surgery. You can find one. I think the one that I watched was, well, I think it's MedStar Health. I can't think of the surgeon's name, but you can literally watch a video of the surgery. Probably most people don't want to watch that, but two things that I was kind of glad I watched it. Number one, for some reason or other, I was convinced they were going to use a laser for my surgery, which kind of goes back to asking your doctor questions. I don't know why it never occurred to me to ask my doctor that, but for whatever reason, I was convinced that they were going to use a laser. And I just kept picturing a laser hitting my spinal column, and honest to goodness, I think, probably never told anybody that, but I think in the back of my mind, that's what scared me the most about the surgery. Like, yeah, is this guy gonna bing, you know, hit the wrong thing? So I felt better about that. It was something I learned from watching the surgery. The other weird thing was the guy gets done removing the disc in this video, and he grabs this tool and he starts saying, oh, do you see this creamy white part? And he's scraping his tool back and forth, and he says, that's the spinal column. And my first thought was, brother, if you're operating on me, get your tool off my spinal column. But then, you know, I thought about it, and it's like, you know what, it's God created our spinal column to be pretty durable, and it's not this extremely delicate thing that I guess I had in the back of my mind. Again, sometimes you have these thoughts, they're somewhat subconscious, and you're not really, it's not in the fore of your mind, but really in the back of your mind, that's what you're thinking. Like, gosh, is this guy gonna, you know, sever my spinal column? And, you know, when I saw that, I thought, come on, it's a lot more resilient. It's not to say that there can't be a bad result. All of your any doctor you see about the surgery is gonna tell you that is a risk, but I think the number of cases are so minuscule. Personally, that was not a concern of mine. Anyway, this is going to conclude part one, and I think next what I'll talk about is how did I get to the point where I made a decision. Perhaps many of you there are at that stage. Talk to you in a minute.